Are you feeling anxious about breastfeeding? Worried about low milk supply or latching issues? If you're pregnant and wondering if you'll even be able to breastfeed successfully, then this video is for you. Today, I'm breaking down the most common breastfeeding challenges new moms face, and more importantly, how to avoid them. Whether it's your first time breastfeeding or you're just nervous about what's ahead, don't worry, mama. You've got this. Hi, I'm Stephanie Poole. I'm a certified lactation consultant and doula, and I'm here to guide you through your breastfeeding journey. I help pregnant moms just like you learn how to breastfeed confidently, even before their baby arrives. Now, we all know breastfeeding doesn't always come easily. It's normal to face some challenges, especially in those early days. And if you've already heard all the horror stories from your friends or seen posts online about breastfeeding struggles, I'm here to give you a reassuring reality check. You can overcome them, and I'll show you how. Okay, let's start with the number one issue so many new moms face: latching problems. This is probably the biggest concern I hear from moms who are just starting out. You've probably heard the phrase, if your baby isn't latched properly, it's going to hurt. And that's actually true. A poor latch can make breastfeeding uncomfortable and can even lead to cracked or sore nipples. So, here's some things to remember. Positioning is key. Make sure your baby's head, neck, and spine are all aligned. Hold your baby close, tummy to tummy, and make sure that their nose is level with your nipple before you start. The next thing you want to do is to adjust the latch. Aim for the baby to take in both your nipple and part of your areola, not just the tip of the nipple. A deep latch will prevent pain and ensure your baby is getting enough milk. Finally, if latching issues persist, don't hesitate to reach out to a lactation consultant. Trust me, sometimes just a small tweak can make a world of difference. Here's a pro tip. In my Bump to Bundle blueprint, I walk you through video demonstrations on how to achieve the perfect latch. It's like having a personal guide right there with you in your living room. Next, let's talk about low milk supply, another huge concern for new moms. Maybe you're already worried. What if I can't make enough milk for my baby? Or you've heard others say they had to stop breastfeeding because their supply dried up. All right, to that, here's a few things I want you to remember. Feed frequently. Breastfeeding works on demand and supply. The more your baby nurses, the more milk your body will produce. Also, stay hydrated. Dehydration can impact your milk supply, so make sure that you're drinking enough water throughout the day. Now, if I can't say anything else, remember, your diet matters. Foods like oats, flax seeds, and leafy greens are known to support milk production. The last thing I'll say in regards to this is to avoid unnecessary supplementation. Introducing formula too early can reduce your milk supply, so try to exclusively breastfeed in those first few hours, days, and weeks, if possible. Now, here's something you might not be prepared for: engorgement. Around day 3 to day 5 after your baby is born, your milk will increase. And what that means is that suddenly your breast may feel full and painful. It can be uncomfortable for both you and baby, and it might make latching a little difficult. So here's some things to remember. Breastfeed often. Don't wait for your breast to get overly full. Nursing frequently can prevent engorgement from happening in the first place. The second thing to remember is to hand express. If your baby isn't latching right away, you can relieve some pressure by hand expressing or using a breast pump for a short time. Remember, when it comes to engorgement, applying a cold compress after a feeding can help reduce swelling and make you more comfortable. Next up, let's talk about nipple pain and cracks, another challenge that can leave you feeling frustrated. Breastfeeding is not supposed to be painful, but in the first few days or even weeks, it's not uncommon to experience some type of discomfort. If you're dealing with cracked or sore nipples, it's usually a sign that something isn't quite right when it comes to your baby's latch or positioning. So, let's start by going back to the basics. Ensure a proper latch by getting as much of the areola in your baby's mouth as possible. When it comes to nipple creams, using a lanolin-based nipple cream can soothe and heal cracked skin. Also, let your nipples air dry after feedings to promote faster healing. Last but not least, let's talk about the emotional side of breastfeeding, feeling overwhelmed. If you're like most new moms, you might be feeling like there's just too much to learn, and the pressure to succeed at breastfeeding can be pretty intense. Maybe you're worried about whether you're doing it right or if your baby is getting enough milk. So, take it one feeding at a time. Remember, breastfeeding is a learning process for both you and your baby. It's okay if you're not perfect right away. Give yourself grace. You're doing your best, and that's what matters. Don't be afraid to ask for help when you need it. Also, consider joining a community. Surround yourself with other breastfeeding moms who understand what you're going through. The right support can make all the difference in the world. Breastfeeding doesn't have to be filled with confusion and stress. With the right guidance, you can navigate every challenge like a pro. I believe in you, and I know you can do this. If you're ready to start preparing for your birth, then I invite you to join my course, Bump to Bundle Blueprint. Inside, you'll find my childbirth masterclass, my proprietary birth plan system, and my breastfeeding mini course that will jumpstart your breastfeeding journey. Click the link below to get started and let me help you prepare for your birth like a boss. Don't forget to like, subscribe, and leave a comment below about what breastfeeding challenge you're most worried about. I'm here to help. Thank you so much for watching. I'll see you in the next video.